Hi everyone, welcome to iMumz Ask Me Anything session. Today we have Dr. Annith Kumar. We are very excited to have him. We're almost getting closer to our 200th session of Ask Me Anything. Dr. Annith Kumar is a consultant at Sri Kumaran's hospital in Tambaram, Chennai. His special interests are laparoscopic pelvic surgeries and reproductive endocrinology. Doctor will be speaking on constipation. We've seen a lot of queries regarding your issues in constipation. So he'll be speaking on it. Post that, you can put in your queries and he'll be happy to answer. Over to you, sir.
Hello everyone. So I'm Dr. Annith. I'm a consulting gynecologist at Chennai. Wonderful meeting you all at the session at iMumz. Means wonderful that iMumz is organizing such wonderful sessions so that it will help a lot of women and expectant mothers to tide over their small doubts which they face on a day-to-day basis. And congratulations, iMumz, for reaching, almost touching 200 sessions with Ask Your Doctor. And okay, so today's topic that they have given me is constipation in pregnancy. One thing that you have to know is constipation in pregnancy is very common. Almost 50% of all the mothers suffer from this constipation. So, what is this constipation term generally mean is that pregnant mothers or anyone having have to strain to pass the stools or having difficulty to and they just pass more than 24 hours or more than 48 hours once they pass their stools is the term constipation. And um, and it is very common in pregnancy. And I know pregnancy is such a beautiful thing that a lot of mothers experience. They get shiny skin, and they are very happy, but along with this happiness, also one of the things that they need to face is constipation also, that they need to get it. uh, what do you do, and what is to be why does this happen is the question that is commonly put forward to me. So there are major, like, there are one of the main reason that it occurs is because of the hormone progesterone. So progesterone is a hormone that has been secreted at day one from your pregnancy. So it is because of this progesterone hormone is why is your baby very safe inside the uterus. The major function of this hormone progesterone is to make sure that the muscles on the uterus relaxes, basically, so that your baby is very comfortable inside, and the uterus is able to provide a very safe and very comfortable environment for the baby to grow. So along with this, it relaxes a whole lot of muscles in your body. And one of the muscles that relaxes is also the muscles around the bowels or muscles around the intestines. It's also getting relaxed. So once this and because it gets relaxed, the uh, movement of food particles through the bowels also slows down. And this is one of the, because it slows down, obviously it leads to constipation. And uh, so, that is another reason is the uterus is one of the organs that is down the pelvis. And then other important organ that is down the pelvis is your bladder and your rectum. Rectum is the organ where the poo or the stool gets stored inside. So and as the uterus grows bigger and bigger, this growing uterus starts to compress the rectum, that is the pouch where the stool gets stored, and there isn't enough space for the stool to pass. And how it normally be position and angle of the rectum also changes. And hmm, uh, so that is, I mean, and woman needs to put an extra force, need to extra strain to make sure that the poo comes out. So the next thing why this constipation occurs is dehydration. um, the Okay, so and there are many reasons as the trimester goes. So I hope everybody knows that there are three trimesters in pregnancy. The first trimester is up to 14 weeks. The second trimester is up to 28 weeks, and and later on up to delivery, it is third trimester. So what happens usually in the first trimester is practically a lot of women face difficulty in eating themselves. So I mean that is a time when it's like hormone surge happens, and it is a new experience for them. And along one of the new experience they get is vomiting in pregnancy, or nausea and vomiting of pregnancy. So that is a separate topic. So what happens is, along with this nausea and vomiting, they don't eat proper. They don't eat properly. They take very less amount of food, and they take very less amount of water along with whatever they're having. So and because as they I mean if you're not eating properly, obviously the stools are going to not get properly formed. And especially you need to drink a lot of water. Pregnancy is somewhere the baby is quite growing. It needs lots of nutrition, and it it sucks up lots of it's a state where you can easily get dehydrated, because part of your body fluids are going to the baby to make sure it grows very much. So all the water around the food particles in your bowl's major job is to make sure it absorbs all the food and water from your food particles and then circulate it towards the body. So the bowls work extra hard to suck in all the water, so that it supports the growing baby also. So with the food particles and the stool particles are are extra hard during pregnancy. So that is why we advise a lot of pregnant women to drink lots of water. That is a major thing. So yeah, as I was saying before, in the first trimester, so because of nausea and vomiting, so you tend to drink less water and eat less, and you don't tend to eat properly also. You lots of food fats are there, and certain foods that are supposed to be healthy are not being taken, and whatever you eat comes out, you puke it out. And so the food habits is one of the major reason. And second and third trimester, in second trimester, what happens is, okay, you get slowly accomplished, you start to enjoy a pregnancy, and that is the time when the uterus starts to compress on the rectum. And uh, so that is the reason why in second trimester that you can have a little bit of constipation. And in third trimester, the uterus becomes really big, and you almost be carrying like a huge, almost, or 4 to 5 kgs of, minimum 3 to 4 5 kgs, including your weight inside your tummy, like the weight of the baby, the weight of the placenta, the weight of the uterus, everything is there. So women usually tend to get pregnant. So a lot of the couple's husband, the husband used to like, come, why is she always tired, sir? I used to say to the they say to her husband, like, try carrying a 2 kg weight the whole day throughout, then you will know how difficult it is to move around. So because of this, the pregnant women, they tend to move around less. They need the rest actually. So once they start move around, starting to move around less, obviously that is one of the major reasons. That in third trimester, that if you're moving around less, the bowels tend to move even more slower. So that is one of the reasons, like you said, to have i mean uh, you need stools. That is that why you get constipation in the last trimester. Okay. So okay, how do I control, how do I um, get relieved of my constipation? So that is what we say. So okay, so for things that are common is, so one is food habits, obviously. So what food habits that you need to change, and what you need to take to make sure that you don't get constipated? So lots and lots of fibers. So in our Indian food, we get lots of fibers from your greens, and lots of fiber from your your routine vegetables, and a lot of fibers from fruits. So one thing that I say to my patients is, you need to don't juice it up. Whatever fruit or whatever fruit that you want to take, never juice it up. Just eat the whole fruit. Like, say, for an orange, I mean, instead of juicing it, and if you eat the whole orange full, you get the pulp and all the I mean, the fiber that is over the fruit goes into it, and that forms a major bulk of fiber for your stool to for it stool. So this fiber is one doesn't get absorbed so much, and it has a tendency to retain water inside the bowl. So once that so when the bulk of the stool gets increased, and it holds starts to hold lot of water content to it. So because of that, your the chance of passing a very comfortable stool increases a lot. So a lot of fiber rich food. So I mean, they consume lots of fruits on and they take it as a whole. Almost all fruits that we commonly get in a market, it doesn't has a lot of fiber in it. So you definitely can take it up. And then next is your greens, your spinach, or uh, greens that you commonly get. Your kira, in Tamil Nadu we say it as kira. So you can have it, and then it definitely improves your and then your bananas, everything. So it definitely helps a lot. The next thing is that a lot of women needs to, and okay, so drinking a lot of water. Okay, next thing is you need to keep on get hydrating yourself. Have a me I ask my mothers to take at least 3 to 4 liters of water per day. It Drinking water helps in lot many ways. One thing in my topic per se is it helps in decreasing the constipation. I already said the reason. Your body works extra lot to make sure it tries to take up as much water as it possible, so that the baby is growing healthy. So taking a lot of water and yeah, so definitely taking a lot of water really helps a lot. And the next is um, hmm, okay, and a little bit another advice that I used to say is, like, as soon as morning you get, take a hot cup of water, and a little bit had a honey and ginger, and then take it up in the morning. So this honey ginger water in the in the hot water, it really starts to make your bowel moves. So anything that is something called as the gastrocolic reflex. You can see it in small babies that you usually see. As soon as they drink up the milk, they start to poo. So that reflexes grow along with us still morning. So like, people have drink a coffee and they start to poo, something like that. And can also be used to stimulate the stimulate the bowel movements early in the morning. So this advice that I give is, take a hot cup of hot water. Put some garnished ginger and some lemon into the hot water, and then have it. So that really helps them, the bowels move, and they help them poo very freely. And the next thing is that you need to, some women needs, if you get constipated, the stools are hard, they need to strain a little bit. The strain, you need to put some extra pressure, or need to extra strain to pass the stools. When you put that extra pressure, extra strain, what happens is that there are your out the anal passage, or the gets a little bit torn. So there is lots of pain in that area. which is quite uncomfortable and it's really displeasure. So next thing that I want to talk about is that. So it is never but it is never advised not to strain at all. So once you strain, it becomes a little bit difficult. So what I advise is you just take a castor oil that is quite commonly available in our kitchen. So just little wipe the castor oil around the anal region, so and little bit, so that it kinds of smoothens the passage for the stool to pass out, and it will be really helpful for, I mean, it is really help, and once if you're doing that, and if you strain, sometimes the stool can tear the anal passage, and that is when the term fissures are coming. So so it is a really painful condition. There might and you need medical help for it to be treated. And so that is there. The next thing, if they strain a lot for a quite period of time, and sometimes because of the pressure of the uterus, there's something called as hemorrhoids. So hemorrhoids are a little bit, and the blood sacs around the anal, they when they protrude out, is called as hemorrhoids. That is the next common condition that is, that we very commonly see in pregnancy, and it is also a painful condition, and it can also cause minimal bleeding on a day-to-day basis that needs to be treated. So uh, that is there. So, and whenever you are not able to pass stools for more than 2 days, or at the max 3 days, it is always best to go visit your doctor and then discuss it with him or her, what to be done and how to be done. So when you come to a doctor, what do you advise? We'll advise all these things. So what to eat, what to be done. So and little bit home remedies, we'll say. And then first thing is always home remedies. So whenever go to this modern medical drugs straight away. So if these are not correcting us, next step we go is laxatives, or bulk forming drugs. So for us, the bulk forming drugs means that it helps in increasing the volume of the stools. So that is one drugs that we go, and the next is the laxatives. So laxatives are basically two types. So one is which increases the bowel movements to happen, and one which increases the fluid content of the stools. So that those are those. So we will prescribe those laxatives, and depending upon the patient, so and their complaints, we choose our group of drugs, and then we prescribe them to her. And third, the next thing is, if this all doesn't work, we used to see, we are seeing also some worst case of constipation also. The woman would not have passed stools for say for even 5 to 6 days. I mean, they think it is a social stigma to discuss it with their husband, or discuss it with their a mother-in-law, or okay, I haven't passed stools for the past 5 6 days. And and when they come to us, we find the stools to be really hard. It's like totally impacted. Like, I mean, when we do internal examinations, we find out that it is like stony hard pellets basically. So we need to do something called as digital evacuation. So we have to remove the all this impacted hard stony stools with our hands, and then with our fingers, and then we do is we give an enema. So enema is where we push in chemical substance. Usually there is a lot of different types of enema. Soap water enema or proctrinal enema is there. So what we is that we put a little bit of this chemical fluid inside the, I mean, this is very safe for the baby, obviously. So it will help in diluting and the hard stool that has been impacted, and it will also increase the bowel movements so that it is washed off. So enema is the last line of I mean, it is the last line of treatment from our side. So Yeah, so this is about constipation in pregnancy in short.
Yes. Thank you so much, sir. You would have answered most of the questions in your talk itself, but I'll first take up the questions that are related to constipation. So, I think you've already answered this. Kavita, sir has already told you the remedies that you can try. She's 8 weeks pregnant and having constipation. So, probably a change in the diet, adding fiber and more water will help, right, sir?
Definitely. Yeah, you need to take lots of fiber, so you can definitely increase your amount of greens that you take. Banana you can take. Drink plenty and plenty of water. Take a glass of hot water with ginger in the early morning. All this can really help you relieve your constipation, and it will go a long way.
Okay, coming to this honey. So, somebody has posted here. Is it safe to consume honey
Yeah,
during
definitely.
pregnancy?
And this is a question I mean, this is on a day-to-day basis. Face this questions. I know that I'll face this here also. Honey is perfectly safe. So thing is that you need to get good quality honey from a good quality brand. Definitely, it will be safe, and you need to check all your certifications of the honey. That like that food standard certifications of honey are good. It is safe. It is not. It is not unsafe in pregnancy. They can definitely 100% take honey in pregnancy. There's nothing wrong at all.
Thank you.
But make sure the
15
brand
weeks
and
pregnant.
yeah,
Acha,
yeah.
yes. Neha is 15 weeks pregnant and she has abdominal pain on and off. How can I differentiate that the pain is due to constipation or uterine contraction pain?
So I mean, she's 15 weeks pregnant now. Okay.
Yes.
So 15 weeks pregnant, the most common pain that the woman get at 15 weeks is something called as the round ligament pain. So what happens is the uterus is attached to lots of ligaments around the pelvic bones. So when it starts to grow, it's kind of pulls up all the ligaments, and it starts ligaments means it's all the structures is attached to the bony structures. It'll go, so those stretching can cause pain. So that is what would be the most common pain. It usually gets relieved with a little bit oil massage or a little bit rest. It usually gets relieved. And if she has this pain continuously, like say if it is a regular type of pain, so for uterine pain it needs to be regular. So if it's once in half an hour, once she gets every half an hour, she gets for 10 seconds or 15 seconds once, or every, and then it slowly gets increasing, like to say every 10 minutes she gets a pain. Then and you can you and uterus is a muscle. So whenever you flex your biceps, you can feel your muscle getting tensed and hard. So if you're feeling your uterus getting tense and hard instead of being the soft nature, then it's a uterine contraction. That is how you differentiate. And pain due to constipation, normal I mean, it usually occurs when you're straining a lot. And uh, if it's too much of pain, you definitely need to see a doctor, because you might it might get relieved with a little bit of medical help.
Thank you, sir. Mm, Neha is 23 weeks pregnant. Can I have Dupalac syrup for constipation? I'm already taking iron, folic acid, and calcium supplements. So, is it safe along with all this?
Yeah, definitely. Dufalac is very. It's one of the laxative drugs that I was talking about. It could be. It can be taken. So another topic that I haven't touched is this iron tablet. So definitely, our Indian women require iron tablet to improve the hemoglobin. Because our diet is such, we are routinely our diet is a little bit iron deficient diet. I mean, so when the woman, as she is entering into pregnancy itself, she is iron deficient. And definitely our Indian women do require iron supplementation to improve their hemoglobin. And iron does cause little bit constipation, and I usually advise not to stop your iron drugs just because you're having a constipation, which could be managed with lots of other remedies.
Thank you, sir. Navi is 19 weeks pregnant. Can we use smooth cream for any cuts in anal rectum due to constipation?
Yeah, as I was saying, you it is advisable to use castor oil to as a part of a home remedy to smoothen out the passage. Other creams are best taken after consulting your doctor, because I mean you need to check whether it is suitable for you before taking any medicated creams.
Thank you, sir. Uh, Ibrahim, coming to folic acid that you were mentioning, iron and folic acid. Should my wife stop taking folic acid tablets after 12 weeks of pregnancy?
Um, yeah, so the recommendations as per the guidelines is usually to take folic acid until 12 weeks. There is nothing wrong, but nowadays we just don't get folic acid as a separate drug. So usually it has lots of other multivitamin drugs which would be helpful throughout a pregnancy. So you can stop taking folic acid after 12 weeks, but I usually ask my patients to continue till the pregnancy, because there are other small micronutrients which can be really helpful in the long run.
Thank you, sir. Uh, Moving on to the next question, you had mentioned that a lady should be drinking 3 to 4 liters of water every day. So Zura is asking, can liquids be taken in other forms like juice or along with water to reach that target, or do you suggest only water as 3 to 4 liters of hydration every day?
Yeah. So I covered these two topics also. So I mean I recommend water alone to be taken around 3 to 4 liters. So instead of taking juice, the woman can definitely take in the raw fruit as such, which can increase the fiber content. Such it's better to take 3 to 4 liters as such water itself.
Mm, thank you. So Nirali is 8 weeks pregnant. She's vomiting all day, feeling tired and sleepy all day, and also facing constipation from the last few days. Anything in particular for her, sir?
Um, it is. I mean, she definitely. I mean, if she has a lots of vomiting, she needs to start some anti-emetic drugs. So there are lots of home remedies for anti-emetics. So one of the anti-emetics that she is, ginger is a beautiful anti-emetic. Basically, it is. I mean, a lot of studies have proven that ginger really helps in decreasing the vomit. Um, so and she needs to upper dose of any tablets or antiemetics that she is currently on, and definitely if she reduces the vomiting thing, she can improve her constipation as such by retaining lots of fluids and taking in more amount of food.
Thank you, sir. Coming to antiemetics, you said, is Paran D an antiemetic? Is it safe to be taken during pregnancy? Nikhil is asking this question for his wife.
So Pan D is basically, I think it's a brand name. I'm not sure, but I think it's a brand name for pantoprazole. So it is.
He has written Paran D, Parond.
Yeah. So I'm not sure of the that brand name
Composition. Okay,
or the composition of the brand name actually. Yeah.
okay, no problem, sir. Next, moving on to the next question. I'm facing severe constipation issues even after taking medicines from the doctor. I'm not finding any relief. The doctor has changed the medicine twice. Please suggest whether I should further go for change of medicines. Even after taking medicines, I get motions once in 2 3 days.
If it is okay. So I mean, so one of the other medical conditions that we see where constipation is occur is because of hypothyroidism. So even in hypothyroidism, your bowel movements start to low. So if it is really severe, I would recommend to make sure that the thyroids are okay. And if the thyroids are okay, I would consider to change laxatives. Our laxatives will be good. Change of laxatives might help.
Thank you, sir. Um, Another user, 14 weeks pregnant, I'm having acidity and constipation problem, even though I'm taking 3 to 4 liters of water and daily banana. I get motion once in 2 3 days, that too very uneasily. So should she go ahead and take some laxatives in that case?
I mean, I didn't. Should you go ahead and take some?
Laxatives in that case?
Yeah, definitely. I mean, the thing about pregnancy is you need to be as much comfortable as possible. I mean, you shouldn't, suffer throughout your pregnancy. There's nothing wrong if you get a little bit help from your doctor to make sure you, have some laxative to pass motion freely. Yeah, she can go ahead.
Thank you, sir. Uh, Preeti is 22 weeks pregnant. How to improve digestion? I'm already eating beetroot and cucumber daily. Is that enough?
Yeah, cucumber is a good source of fiber. She can definitely have. I mean, if she's not diabetic, and she can definitely have increase in, increase in banana, increase in greens, and make sure that she has a good amount of exercise. Like walks half an hour. Walks about 1 hour in a day, and gets into this pregnancy fitness yoga. I mean, all this will definitely help in, increasing. Decreasing the constipation.
Thank you, sir. Ria is 14 weeks pregnant. Now, you just mentioned banana a couple of times. She does not like banana. So, people say it is an important fruit to get all the vitamins. What is the alternative source for it?
Uh, Alternate source for banana. I mean, you can take Goa. Yeah. So if you don't like banana, you can definitely go to the Goa. Goa has a high. You take it with the seeds of the Goa. It's pretty safe and it has lots of fiber. So if she doesn't like banana, she can go ahead with Goa. Try it how it is. I don't know if she doesn't like Goa also, she can, she can almost try any fruits. It is not a specific. You can take almost any fruit that she likes.
Thank you, sir. Sandhya is 9 weeks pregnant. She's suffering from fissure, constipation, and vomitings. So, any suggestions you have for her? She's, I think, suffering with fissures. So,
So see,
that's
you actually told it in the opposite direction. She's actually basically suffering from a vomiting, which causes her constipation, which is leading to a fissure basically. So uh, you need to correct it. In this order to make sure symptoms are, problems are corrected. So for fissure, if it is really if it is really bad, we suggest to use something called as lignocaine jelly basically. So it is something that is applied around the local area, around the anal region, so that it kind of nulls the pain when she's passing the stools. So it is best taken after consulting a doctor. So how you adjust my patients is, 15 minutes before you're planning to pass your stools, take a good amount of this lignocaine jelly and apply it around, apply deep inside your anal region, and then pass it on. So this will help to smoothen the passage, and it will nullifies the pain also. And you need that. This is just a symptomatic treatment for fissure, but you need to take, there's any means when the acute fissure, it might be having, it's be inflamed also. So it is better, it is we usually add a antibiotic to make sure it doesn't get infected more. And yeah, other and you need to correct your constipation by increasing your fluid, your fiber content, vomiting by taking up a antiemetic. So yeah, this is how you go ahead. So initially you can just try to reduce the pain of your fissures and then take it one at a time.
thank you, sir. Uh, Deepthi says, I'm 16 week pregnant. Thank you for all the amazing tips. I have been consuming a lot of greens, water, and fruits, and I do not observe any constipation. However, now I have to pass stool twice a day as I cannot clear all at once. Am I consuming a lot more than required? Should I reduce it? And also, one more question. Another Deepti is 9 weeks pregnant and having loose motions from the last 2 days. So suggestions for them.
Okay. Dipti, I will not advise you to decrease what you're eating. So, during the initial part of my talk, I did mention that, the rectum that which stores the stools, the capacity of the rectum is reduced. So, with being without non-pregnant, it cannot hold as much stools where it can usually hold. So it is even if you decrease the stools, if you decrease the amount of food, you will definitely need to pass twice a day, because it is that much is once the capacity is less, the evacuation is quite frequent. So it is not an abnormal thing that you are facing. It is quite normal to pass 2 times a day, and it is okay. You don't definitely you should not reduce the amount what you're consuming or what you're taking every day. And loose tools, another DP that I asked, it's you need to know. It is better to consult a doctor, because we need to find what is the cause, whether it is an infective cause or is it is a normal. So if it is infective, you have taken out any food from outside, or any spoiled food which might contain anything, you need to visit and take proper treatment for it. If your home remedies are not getting corrected, because if too much of water is lost from your body, it can cause a little bit harm for your baby also. The water on the baby might get decreased, you might get dehydrated, lots of things, and preterm labors can occur. So it is always better to go to your doctor and get it corrected, or with the course of antibiotic or something like that.
Thank you, sir. Aruna is 16 weeks pregnant. I am passing stool in dark green or black color, whatever, in spite of whatever I eat. I am taking iron and calcium tablets. Is passing stool in this color any cause of concern?
It is okay. If you're passing black stools, it means that you're taking your iron tablets correct. The one sign that that you're taking iron tablets correct is passing black, or black stools. Um, so it is quite normal you to pass black stools, and once the pregnancy is over and you stop taking your iron tablets, the stools will return to normal. And I'm not sure about the green stools, but green stools depends upon what kind of food that you take on a day-to-day basis. And if it is not that frequent, I don't think you need to worry so much.
Thank you, sir. So there are a couple of questions asking if it is okay to take tender coconut water.
Yeah, tender coconut water is the best source of fluid that is out there. Actually, taking one tender coconut, or more than one, or two, even two tender coconuts per day is really, really good. It replenishes your electrolytes, your the potassium, sodium, all the things that it needs in the body, and taking and it is a good source of it's a good source of micronutrients available also. So definitely, if you are able to get under coconut, I'll advise you to take it till your delivery, or even after delivery, until you're breastfeeding. Anything, it's a go-to drink that is there.
Thank you, sir. Um, Cheryl says she takes Softeron iron tablets, which does not cause constipation, but she has severe gas and acidity issue because of it, and she is still vomiting, even though she's at 22 weeks now.
Okay. Um, uh, so, it is. I'm not sure whether iron tablets are causing a vomiting. So, pregnancy itself can. Everybody knows pregnancy itself can cause vomiting, but so very rarely. Usually, in 12 weeks, what happens is the vomiting stops. 12 to 14 weeks. But for some people, it can go up to 22 weeks, or even up to the end of the pregnancy. So I will ask her not to worry if she's not vomiting for more than 3 times a day. And yeah, and so sometimes even the some smell of the food or a certain taste of the food can trigger a vomiting sensation. And if something the taste of the smell of the iron tablet or the taste of the iron tablet can trigger a vomiting sensation, so probably that might be the reason. And she could consume it with some other food that she likes, or so that it doesn't stimulate a vomiting sensation per se.
Thank you, sir. Rita is 19 weeks pregnant. She wants to know, is it better to use Indian toilet or Western commode during pregnancy?
Okay. If I would, Indian toilet is the best, basically. Um, okay, there are multiple reasons why I would say Indian toilet is best, because it is the position that you sit down. When you're sitting in a Western toilet, you're sitting in upright positions, and your the outer passage, the anal and the rectum as an angle. So that in the big compress, so it further narrows down the space of your passage of stools. But in Indian toilet, it doesn't happen. The rectum and the anal passage are in a straight line. So obviously, when it's in a straight line without kinking, it passes more freely. So that is one reason. And passing in a vector toilet, and it flexes all your muscles. And in a long run, at the end of 10 months, it will be really helpful when you are planning for a normal delivery. Patients are more comfortable. It's like exercise. You're squatting down and getting up. So it's definitely in long run, it is really good.
Thank you, sir. Neha is saying, sir, I have two constipation issues. I have to put a lot of pressure while passing motion. It is too tiresome, and I'm scared if it would harm the baby. Could you give your opinion on whether it is safe to apply pressure or not?
So you should not, definitely you should not strain. There is no question about it. You should increase your amount. Increase the food that you are consuming. You should increase your fiber content and water content. Make sure it passes more smoothly. You can use the castor oil so that it passes more freely out. I'll advise not to strain for passage of stools. Definitely.
Okay. You had suggested that a pregnant lady should be drinking 2 to 3 liters, 3 to 4 liters actually, of water. Now, Jyoti is 19 weeks pregnant and she does not feel like drinking water at all. Even if I drink, it is just a liter. Can you suggest on how I can increase my water content?
Mm, okay. If I do know, I do understand that there are. It is quite common to have certain food that you like, certain foods that you don't like during pregnancy, and I know water is a type of food that you don't like also. So what I suggest is like you can make water drink that you like. So at this time, you can do. Mix it up with a certain thing that you like. You can put it as a flavored drink, as a flavored juice that you can mix it up and then definitely drink it up. So there are these um, you can make it as this is the time when you take it as a juice basically. I will not advise you to go for this commercial juices available in your supermarket, like say for Tropic and whatever it is. So because all those content do have lots of sugar content in there, it will definitely increase your calorie intake per day, and it can increase the chance of becoming a diabetic. It can put and increasing the baby's weight. So commercially available drinks are not available. Not suggested. But this is a time where you can make it as a lemon juice. Like little bit lemon with salt. Increase the whole 1 can liter of lemon juice. You can take it. So citric fruit itself does decrease your feeling of vomiting. So that you could try. Um, and you can use jeera water. So jeera with Having jeera and water, like in Kerala, what they do that you could try. I mean, honey, you can honey ginger water will be good. So you can try different. I mean, alter the taste of water that you finally might end up liking. Yeah.
Thank you, sir. Uh, Moving on to the next question. Sudha is 10 weeks pregnant. I'm taking diabetes tablets and thyroid tablets from 10 days. After that, I'm facing constipation. What is the precaution I can take? Please suggest.
Okay, so at 10 weeks, so as I already telling, thyroid itself can cause constipation. So, I mean, once correcting, I mean, and pregnancy per se, so you have two factors that can contribute to constipation. So, one thing is I suggest is take your thyroid tablet correctly. So, the correct way of taking thyroid tablet is you should take it in the empty stomach. So, preferably at around 7 to 8 in the morning, not more than that. So, and you should take it in the same time of the day. If you're taking at 7 a.m. in the morning, make sure you take 7 a.m. on a day-to-day basis. Keep an alarm at 7 and then take it. Even if you're feeling sleepy, go back to your sleep. And after you take your thyroid tablet, make sure that you don't drink anything or eat anything for the next half an hour because you need the time for the thyroid to get absorbed. So if you're taking, so this will help you maintain a proper thyroid level throughout the day on a day-to-day basis. So this can decrease your constipation per se. Diabetic drug. I mean, if she mentions the word drug, I think she's taking a tablet. So the tablet that is usually is metformin. So metformin itself is a drug that can cause a little bit of gastric trouble and constipation. So I mean, take that drug, take metformin along with food as is what we usually take it along with food so that its symptoms are getting decreased. And she's 10 weeks, so drink lots of fluid and all the other advice that I've been saying. So, lots of fruits, vegetables, and greens, water, and yeah, this is what to go ahead with.
Thank you, sir. Swati is taking Premafin Plus. That
Mm,
is like a combination of liquid paraffin, milk of magnesia, and sodium picosulfurate oral emulsion. Okay.
mm.
She's taking this 5 to 10 ml twice a day. Is this laxative safe?
Yeah. So you can take it once a day. Like at the end of the night, just take for 10 to 15 ml per day. Is not going to cause much. It is safe in pregnancy.
Thank you, sir. You spoke about Indian toilet being better during pregnancy. Hema is 29-week pregnant with twins. So she's asking, is the Indian toilet suggested for twin gestation pregnancy as well?
Um, I usually say, all these Western toilets and all have been only in vogue for the past, I mean, like say for like probably last 150 years or 200 years in India right now. Before, like, I mean, it come to common general public use probably in the last 100 years maybe. So before that, all our ancestors were, they have to use the Indian tile of toilet or Indian tile of passing motion every day. But being a twin pregnancy, you are at a little bit extra risk. So it depends upon patient to patient. So we need to look at your cervix length and if you had any encirclage done. There's lots of things that I need to look upon before commenting. Or if you are a low risk pregnancy, and if you are a dichorionic type of twin, and I would definitely suggest you to use Indian toilet is no harm. But if you have any complications related to twin, I would say take as much of risk as possible and go ahead with a Western toilet, should be safe for you.
Okay. Sir, Ramya is asking, I'm taking Calmacid Forte for burning sensation in food pipe. Will this cause constipation?
I mean, I didn't get the drug that she's taking.
Calmacid Forte.
Um, In Chennai we have a different brand of drug. So seriously, not familiar with the brand that she's talking about. But all the, some drugs that you do take for acidity of burning of the food can cause constipation. It is well documented. It is well known. But I mean, one, but so if you're not getting constipation when taking the drug, it is not a problem. But if you are getting constipation, but this drug really helps you in your acidity, so you need to balance it out, and you need to think which is better or which is not better.
Thank you, sir. So there are few queries about having abdominal cramps. Like I have seen at least 4 5 queries about it. Ki I get abdominal pain. Is it normal?
Okay. Abdominal cramps. Okay. Like I was this okay. This is you need to definitely know that is a topic on let's say false pains, or whether it is a true labor pains. That is a question. I'm trying to get it. So sometimes it is okay to have abdominal pains before pregnant. Before labor. So it is called as Braxton Hicks contractions on its own. It is like a preview, or like say, a teaser or trailer for a movie, like what happens before the film.
So,
You are
so
like,
some of them are also in the first trimester. I see that 5 weeks, 8 weeks, 12 weeks, they are feeling a little bit of cramps here and there.
okay, so yeah, so if you're in the early, if you're late in your third trimester, it abdominal comes up probably because of your false pain, Braxton Hicks contractions. So it is like, as I said, it is a trailer to your full labor. So if it is like only once in a day, or if you're getting to rarely, like 2 to 3 days once, I will not be much. You need not worry too much about it. But if it is, as I said, if it's getting more frequent, like every hour you're getting one, if it's a regular one, if you time it out, if you're getting like every 1 hour once you get, and every half an hour once you get, then if it is a regular type of pain, and if the pain is progressively increasing with each contraction, you definitely each time, so you need to visit your doctor immediately, because it can be a labor pain also. So if we are in the early phase, say 12 to 13 weeks, or before that, that is a time when your uterus is growing very much. So what happens? So as you as as it's uterus is such a small organ. So if it is a non-pregnant, if this is how big your uterus is. Slowly starts to grow as the baby starts to grow. So there is lots of stretching and pulling that occurs when as the baby is growing. So definitely you're going to have lots of muscle cramps in your abdomen or in your tummy. And if it is not really too much of a pain, and if it is just a bearable pain, um, it is quite normal. And sometimes if it is sometimes some working women who say that it is too much, we do add up a progesterone hormone supplementation for them to increase I said that progesterone is the hormone that relaxes all the smooth muscles. So we increase the progesterone supplementations for her, so that she gets relieved at the early phase of the pregnancies. um, Otherwise, a little bit of oil. You're using any oil like olive oil or coconut oil, and massaging your back of the, you're massaging a back or massaging a pelvic regions on the tummy. It relieves lots of pain. And drinking coconut or tender coconut water. All this really helps in decreasing cramps. I understand they say that it's like my menstrual cramp that I'm feeling occasionally. So yeah, that is how your uterus is getting bigger, and menstrual cramps do occur. And if it is not frequent, as I said, you don't have to worry about it. When you're doing next consultation, just ask your discuss your doctor with it. We do have certain things in the scan that we look to make sure it is thing that need not be worried.
Thank you, sir. I think you've answered the other set of questions that I was constantly getting is about back pain. So they can massage with coconut oil or olive oil. Yeah,
Yeah,
for the back
you
pain,
can
right?
do
Yeah.
that.
Yeah. So, sir, other set of questions I'm getting today is regarding baby movements. So, some are in the 17th, 18th week and getting anxious about when the movements will start. A query is about 21st week. Like I had got some movements yesterday, but I haven't felt it today. So, should I be worried? And one query is about 31 weeks. The movements have gotten less compared to earlier. So if you could just guide them on different
Yeah,
baby
definitely.
movements. Yeah.
So, okay, so this is a very nice, I mean, good, nice thing to talk about. Okay, so it is, I mean, if you're a preemie means if you're first time pregnant, so it is you will definitely take even up to the end of 6 months to feel your baby movement. That's quite normal. It is, it varies. So if mother is very thin, and if thin mothers feel the baby movements very early because it's your skin, top of the skin, that you actually feel your baby movement. I mean, you can feel the movement that is transmitting. So mothers who are a little bit on the higher, heavier BMI, so they might feel a baby movement a little bit late, and sometimes there's an organ called placenta. Placenta is an organ that uh, transmits the blood supply from the mother to the baby. So if suppose the placenta is anterior, that means the placenta is on the top part of the uterus. You might feel a baby movement a little bit late because the movements can get dulled out. So until 24 weeks, some women might not. It is quite normal not to feel the baby movements, or until 24 weeks, you might feel little bits of movement here or there. But only after 6 months, you can on a constant basis that you can able to start a baby movements. I have known mothers, who have not, I mean, who feel just very few movements throughout the pregnancy, and they have had very safe deliveries. Okay, so for that is a question for women who are, I mean, in the young, I mean, little bit lesser weeks. So at 31 weeks, what I need to say that you need to be a little bit vigilant at 31 weeks. So if you are having doubt about a baby movements at 31 weeks, so what I usually say is you need to make sure that a baby movement is less. So you need to be objective about it. So there's something called as the baby movement chart that you can monitor. So I will suggest that after only you should have noticed by now that after each meal that usually baby starts to move around a lot. Like after, I mean, it is when that your body is highly with glucose, and baby also get lots of energy to move around. So after, like say after each meal for 1 hour, count your movements. So if it is less than 6 for 1 hour after a meal, and so you need to, I mean, then you need to go to it. If it is more than 6 or 8, you don't have to worry about it. So like after breakfast, lunch, dinner, for one whole day, you can monitor the movement, document it, and then if it is less on a day-to-day basis, then you can you need to go to see a doctor.
Thank you, sir. So, Umang is saying that she's been taking blood thinner injections daily, which has been advised to continue till 8 months. Is there any alternative medication for the same, as it is quite painful and my stomach is all bruised already?
Yeah, so if she is on blood thinner, I mean, I'm not sure why she's on blood thinner. There's lots of reasons why we start a woman on blood thinner. But if she's on blood thinner, I will not even advise her to stop even at 8 months. I mean, we usually take it till delivery. Just before delivery, we stop the blood thinner, and then even post delivery also, we need to be starter on blood thinners. So one advice that I give on a blood thinners is, changing the type of injection that we use. Depending on the thinness of the injection varies. So usually what we get in the market is 24 gauge. That is the size of the injection that we say. So she could move on to more thinner injections, say at 24 or 26 or 28 gauge injections. Which she had to discuss with the doctor. So using a thinner size of injection, will reduce the pain, and it will definitely reduce the bruising in her abdomen. And next thing is, after each injection, she need to compress it for some time so that it doesn't bruise a lot. So I will not. I mean, there isn't much of alternative. Also, she needs to go ahead with the blood thinners.
Mhm. Thank you, sir. Uh, so I'll not keep you for long. I'll just move on to the last set of questions that are on diet. So, like there are questions on baby not gaining enough weight. So, what kind of foods would you want them to add to their diet so that baby gains healthy weight? And Varsha is also saying, I don't feel like eating vegetables, so I eat chapatis with chili pickle and all that. So is that okay? And also, I got a few queries about cornflakes with milk. Is it okay to be taken as breakfast or snacks during pregnancy?
Okay, so baby not gaining any weight is so usually what we advise them is to increase the protein intake that she has. So lots of natural level proteins is your the channa, have a egg white. If you are taking non-veg, you can take a meat based protein. There are other sources of proteins like your sprouts, beans, soyas, legumes, anything which has a high source of natural proteins. Or there are certain protein powders are available. I will not ask them to directly go from other, I mean, all this commercially available brands of protein powders available, because along with protein they have lots of sugar content added to it. So I mean, discuss with the doctor regarding which brand of protein powder that you can take. So increase your I mean, increase your protein intake will definitely you can feel which will superimpose on your baby also gaining little bit weight. But if other parameters of the baby's blood flow is good, I will not ask you to not to worry about too much, but definitely increase your protein intake, which might indirectly help in increasing the baby's weight and diet wise. Okay. So another set of questions that I asked. I mean, can you just
Yes.
repeat? Yeah.
Yes, yes. There was a user who does not like to eat vegetables, so she's been eating chapati and pickles and all that. So if that is okay. And the other question was if cornflakes is okay as a breakfast or snack. And one more question, you mentioned sugar. So I had seen a query if it is okay to take sugar during pregnancy. She likes to take curd and sugar and all that. So white sugar, how safe is it?
Okay. If I mean, okay, so I'll go one by one. Chapati with pickle, if you are okay with that, and if you don't have any complaints regarding it, go ahead. But make sure that you get your calories and nutritions from other sources correct. But if you're okay with chapati and pickle, and if you are into it, definitely nothing wrong in that. You can go ahead. The next question is conflicts with milk. Yeah, I mean, I was so if conflicts, so it has some amount of fiber, and you can definitely take it. There is nothing wrong. It is a routine breakfast that is throughout the world. But like, instead of taking a plain conflicts, you can definitely go for this conflicts. I mean, I don't know what these conflicts are, like, which has this other sources of wheat or other sources of millets with them.
Muesli? Are you talking
Muesli. You can go ahead with muesli. I mean, that'll be much better than a plain cornflakes, which is basically which is higher calorific value. Um, and the final question was sugars. Yeah, I mean, but if your sugars are, if you're not diabetic, and if you're well within your, I mean, and if it is not, if your weights are normal, if you're not gaining too much of weight in your pregnancy, then occasionally taking sugar is it is okay. It is not an issue. Hello.
Yes, okay. Uh, Thank you, sir. I think we still have a lot of queries for you, and the users are very happy. You've given them some valuable advice, so many tips. Thank you very much for doing this with us. And to all the users whose queries we could not take in, sir answered so many questions in this short time. You can definitely post it in the feed section, and one of our experts will reply to your queries within the next 24 hours. Till then, take care, and we will see you in the next session.
Bye.
Thank you, sir.